So I was a part of an entire symposium that was actually designated toward heterogeneity of Alzheimer's disease, and that can be sort of described many different ways, whether it's mixed pathology. So Alzheimer's disease, as we know, is neurofibrillary tangles and amyloid plaques, but there's also a high frequency of Lewy body disease pathology, TDP-43 proteinopathy, and vascular disease. And so the first talk of the session that I went to was by Glenda Halliday out of an Australian group, who really gave a great overview and sort of really surmise perhaps this intersection that may be occurring of these different proteinopathies. The second talk focused on autosomal dominant forms of the disease and really kind of exploring more of the neuropathology, whether it's the different phenotypic, but the frequency, as well as there's this really impressive collaboration. It's actually an international collaboration called DIAN, the Dominantly Inherited Alzheimer's Disease Network. And so Nigel is their neuropathologist in residence, and so they really just kind of went into a lot of the different aspects. My specific talk was on the clinical pathology, where we looked at age of onset, we looked at perhaps the differences based on the clinical phenotypes, because not everybody has a memory disorder. Alzheimer's disease patients can also present with behavioral differences. So I kind of went into some of the nuances of that and what the potential implication is for treatment efficacy. And then the talk ended with, he's actually a psychiatrist by training, but Bradford Dickerson, but he went into a lot of the neuroimaging phenotypes of the different disorders.